So I am Dr. Heather Moore, and today we are going over the 3 things that you can do right now to decrease your back pain. So one of the questions that I often get is, what can I do at work? I get stuck in a chair, I can't move, I'm in a meeting, I'm not going to stand up and make a fool of myself when I can't move. And ideally, you're getting up every 15 minutes at work. Ideally, you're not sitting for that long, but we don't live in an ideal world. So many people with back pain, chronic back pain, pain that's being treated with injections, are coming to me and saying, I sit for 8 to 10 hours at a time. And here's your problem, is, you sit for 8 to 10 hours at a time. So in the situation where you can't get up every 15 minutes, and I want to just clarify something. When I say get up every 15 minutes, I'm not talking about get up, go get a drink at the water fountain, talk to your friends, take this 15-minute break. So really, at the end of the day, every 15 minutes you're getting up and taking a 15-minute break. I just simply mean, get up, move, change position, something to get your back, get that blood flowing in your back. What people don't realize is that a lot of back pain and a lot of what you experience at work, or that stiffness, that achiness, is all muscle related. So when you change position, it's going to help decrease some of that pain. And when it starts off and it's just stiff, or it's sore, or it's achy, that's the time where it's treatable. Those are the times where it hasn't gone into a herniated disc and it hasn't progressed into something that may require injections or surgeries or constant medications. So ignoring that stiffness or ignoring that achiness, brushing it off, thinking it'll go away the next day, is not the case. So you really want to make sure that you are paying attention to your back, listening to it. If it's telling you it's achy or if it's sore, don't dismiss it as my dad had back pain, so I'm going to have back pain and I'm just going to sit here and deal with it. There are certain things that you can do right now in order to help relieve it. So we're going to go through those 3 things. And hopefully some of you can practice them as we go right now. So this is Jeff, lovely student that gets to volunteer and help me this summer. So he's going to be our guinea pig. So the first thing that you can do right now to relieve your back pain is to stand up. Or if you're standing up, sit down. Okay? So here we have Jeff all slumped over, sitting at his desk because it's, I don't know, somewhere around 2 o'clock in the afternoon, and you're tired. So all he has to do right now is just stand up, okay? That literally is going to send a rush of blood to his back. He doesn't have to be here for very long. If he's able to take a walk around his chair, that would be great. If not, he can just stand here for a few seconds, sit back down, and go do the same thing again. All right? Some of you, if you've had pain or you've had stiffness, for a while, it might take you a little bit longer to really get that blood flowing. So stand up for a minute or so. If you have a sit-to-stand desk, everyone went from one extreme to the next with this. We went from sitting all day to now standing all day. If you have a sit-to-stand desk, every 15 minutes you should be going from sit-to-stand or stand-to-sit. All right, so same thing here. If you're standing all day, sit down, and your back, you're going to get a rush of blood. Any type of movement is going to allow that back to have a rush of blood. It's going to allow those muscles to feel better, okay? So that's the first one. I know, very, very easy, but a lot of people overlook it because they just keep plowing through and they keep plugging and chugging. The more you have pain in the back, the more your brain is sending signals to help your back get through the day, the less work you're able to do. So if all you're doing is sitting there trying to sit, because your back is in pain and you're not really concentrating on work because you're trying to sit because your back hurts, you're actually less productive. So if you actually took a 5-minute break or a 1-minute break and you stood up, you would be more productive when you came back because your brain can now focus on the task at hand. It cannot focus on trying to heal your back pain and get you to do your work effectively. So that's the first thing that you can do. All right, so this next trick is for those people who are like, I get caught in meetings hours at a time. There's nothing I could do. I am not going to be that person who stands up and walks around in the middle of the meeting. I get it. I don't agree with it. You should just, at that point, prompt the entire meeting to stand up, but I get it. So the second thing is you're going to drop your leg, and I'm going to show you, well, Jeff's going to show you what we mean by this. But what you're going to do is a lot of times as we sit, And the longer we sit, we wind up slouch over. Everything's pulling us forward. Everything's pulling us in this direction. And it really takes a lot of effort and a lot of thought and a lot of energy to sit up nice and straight. So what you can do is you can just simply drop one of your legs back behind your chair. Now I know if you Google, even some of the articles I've written, this is not correct posture or whatever. Your feet aren't flat on the floor and this is going to mess some other things up. It's okay. It's not going to mess anything up. And actually what it does is it pulls your pelvis forward. So you don't have to do anything. And if you just want to try that right now, all you got to do is just put your foot behind your desk. It's going to pull your pelvis forward, and you're going to be able to relieve some of that stress on the back going back. Okay? So now you're actually in good posture. Now I know sitting like this and sustaining a posture like this isn't the best thing. This is not designed to be done all day. But again, if you're sitting in that meeting and you can't get up, or you're sitting at your desk and you are just stuck and you can't get up, and you're moving in all sorts of directions, and you're winding up dancing, just trying to keep your back from screaming, this is a really good way just to relieve some of the tension on the back structures, okay? It's not a fix. It shouldn't be replaced for a stand. It shouldn't be replaced for a walk. But this is, if you can't get up, this is a really great way to help your legs pull your pelvis into correct position. And this really requires no effort. So if you feel like you're sitting up really straight and you're working hard to do so, drop your leg behind your chair. It's going to automatically bring that pelvis forward. You're automatically going to get better position. The final thing you can do right now, which is one of my favorites, and you're going to see, we prescribe this all the time, I do this all the time, is cross your leg. This is one of the best things you can do, regardless if you have back pain or not. This is hips, backs, the whole thing. And you can do this throughout the day, which what makes it better. What you want to do is you're going to sit up. You're going to pull your ankle over your other knee. You're going to sit up nice and straight. Some of you may feel a stretch with this. Totally fine, okay? What you don't want to do is start pushing down on this knee. All right? If you feel a stretch right here, leave it there. Now, if this knee is up and elevated, you saw how Jeff pushed, as he pushed down, he came forward. We don't want to do that because now he's slumping forward. Now we've got a whole other issues when we're trying to solve back pain. We're actually creating some of it. So if you don't feel anything and you're in this position, you want to go ahead and sit up nice and straight and then lean forward. So you're hinging at your hips. You're not breaking your back to bend forward. All right? So it's a hip hinge. It's not a coming forward at the back. So if you notice, he turned so you could see how he's going to come forward at the hips, keeping his back perfectly straight, and then coming over his hips as opposed to slouching forward. Now, again, if you feel a stretch when you just cross your legs over, that's fine. That's normal. That's okay. Leave it there. And you can leave this there for 5 minutes. You can leave this there for a couple minutes. You're not applying any stress to the body, and you're actually stretching your hips. And here's another little tidbit. If you have problems getting into this position, like you can't lift your leg up or it keeps sliding down, there's a problem. I don't know exactly what the problem is, but you definitely should be in our office because there is a problem, all right? So if you are unable just to gently and easily cross this leg over like that, and you're kind of pulling at your pant leg and you're reaching down, that's a significant problem that you do want to have addressed. So I hope those three things help you finish out the rest of the day, relieve some of that back pain, watch your posture at work, use your sit-to-stand desk. If you want us to take a look at your back and see if there's anything else you can do, you can fill out the form for a free exam, and we will gladly have you come in and take a look, have a consult with us, and see what's going on with your back. Otherwise, have a great day.